To be here, so exciting. Just looking at the lineup of the speakers before I was invited to be here, I'm just honored. So with that started, as you can do for yourselves, the title of my presentation, Compensation Nation. With that said, I would love to share with you guys the reason why I left clinical dentistry 2 years ago after being a dentist for 12 years. And what had led me to be here in front of you guys to share that story with you. Here's my why. That's my little girl, Melody. When she was born with a very narrow airway, snoring, falling asleep in the car every time and snoring, having ADHD symptoms, which is called misnomer, terrible twos and terrible threes. I think we passed that already. She had every single sign that you could care for that we know in this room, but none of the 5 board-certified specialists that I went to get help for my daughter could tell me that. So between the picture on the left and the picture on the right, there is 3 years of difference. And what I actually had to do to go and learn how to treat my daughter to get her to the right side had led me to understand one thing, that straight teeth don't fit on crooked bodies. We're in the age of genetically modified food and epigenetically modified humans. Let me elaborate. The picture on the left is a skull of a human about 200 years ago, not that long. That's not how the genetic changes. This is a skull of a human being today. And you might think that's an alien. Actually, that's a child in my practice right now. Well, there's one thing for sure, that humans are becoming machines, that we are actually raising little robots. Why? I have convictions of that, because post-industrialized modern life has put more demand on our bodies to change than our capability in our system is able to. We're back. So here's my convictions on why I do believe that to be the truth. Because we're walking on hard floors and eating soft food. And that's totally the opposite of what our genetic was indicated to do. We're breathing in the polluted airs in air-conditioned homes. We're confining our senses of sight and hearing to walls and to floors that are foreign to our genetic. We are meant to go outside, walk on uneven floors, climbing boulders, riding on horses, and yet we're looking at screens and TVs and converging our sights and hearings and not able to express them. We're nonverbal communications, emojis and texts more than using words. What our throat muscles are going to do to actually develop to allow us to do all of those? And there's a lot more that comes. What's the result? Our senses that were given to us to develop us into human beings in order to understand how we belong into the 3 dimensions never get a chance to develop. So what's the result? Compensation, ladies and gentlemen. So what do we have in common between all the modern diseases that we know today? The root of all modern diseases is one thing, inflammation. I think there's not one single person, no matter what initials after your name, that agrees with that. And where does that come from? Well, we all need to know the state of dysautonomia, the common denominator that pours into it happens to be the truth. Our sympathetic nervous system was given to us for a reason. If the shooter in Boulder was in this room right now, I would love every single one of you to be able to activate your sympathetic nervous system and run. But if that nervous system is on just at a low grade, for me to sit down here and listen to Bahar talking about inflammation, we've got a bigger problem. And the problem is that sympathetic tone that's on is not just because there are reasons for it. Here are some of the things that can cause that. Dysfunctional breathing. Every single person that came in here, I'm probably preaching to the choir at this point, confirmed that for us. The poor posture that reflects it, dysbiosis, emotional traumas, poor circadian rhythm, poor sleep patterns, stimulation overload. There's no shortage of that in our children these days, and there's no rest in our system. So simply our genetic can't keep up. We were given some capabilities to adapt and change and plastically move one thing to another and change. But when that demand and change is constant and more than what we can keep up, that's when we see the compensation pattern. So we need a global diagnosis. We all agree. And every single person that talks here before me and after me would agree with that. Because human is a puzzle. We can't just decide, because I'm going to a dentist, I'm not going to worry about anything beyond the hyoid bone. But that's not how the body works. The body knows there is one way to make up for a function that's not there and to compensate. And until we understand that compensation, why it happened, and how, we can never treat it correctly. And unfortunately, there is no ICD coding for healing and restoring the homeostasis, which is the goal. Let me elaborate. Here's our system. That's the way it was taught to me and every single person that went in some kind of a medical education. Subjective. That is limited by the letters after the clinician's name. You cannot ask about their gut if you're a dentist. The objective, it's limited by the third party. I need to ask for permission for an MRI or a CBCT or a home sleep test, because that's not your area of practice. But then we agree that the assessment requires to be debriefing between all these doctors and maybe even the therapists, as the speaker before me elaborated. And the P, in my opinion, should stand for protocol. That means who does with what, when, and how. But how can we achieve and grab the difference between those letters? By cutting that in half. There should be no separation between doctors to get all the information that's relevant from nose to toes to be able to treat the patient. So all these 3 years are narrowed down to this 3 rule of B after Bahar, obviously. So every breath needs brain balance. Let me elaborate. Breathing is first. That's the first innate reflex that kicks in. So our bodies were biologically invested to be upright. And for that matter, we need to be able to breathe while we're walking, balance our eyes with the horizon, and keep our brain over the center of gravity so our head doesn't fall forward. So if the first 2 are a compensation, you could bet the third one is going to be a compensation. So the entire kinetic chain goes into a compensatory mode to support the head as we propel, shall I say, in just 1 plane of motion instead of 3. So the curvature of the spine and cervical and lumbar extension is going to perfectly reflect that. As you can tell, the picture on the left is a nasal breather and the one on the right is a mouth breather. So we know that posture to be a reflection of the breathing and the balance. We have that in the literature. I'll let you guys read that for yourselves. I happen to see the 3 triangles in here. As we stand upright, the hip, the rib cage, and the head have to support itself in all 3 dimensions as we walk. So where did they come from? Was it upstairs? Was it downstairs? I don't know. I wasn't there. But we got to find out. So we need a paradigm shift to be able to answer that question. Instead of asking how sick, why don't we ask the question, how far from the green? These are both my children, by the way. And when we know that the center of gravity has to be through our center, why are they deviated from it? Why are different joints not where they should be? And if you ask that question, we quickly find out it probably has something to do with their function. Because restoring the homeostasis from womb to womb requires us not thinking, managing disease 1 symptom at a time. And problem is, the knowledge that we all acquire here and we all have shared grows way faster than wisdom is adopted. This is a dear patient of mine that I've treated with one of the therapists that shares a room with me here today. I'm so proud to see that what the picture is on the left is representing is her at the stage where it was dysfunctional, not just breathing, in posture, in just about everything that she does. And the one on the right is a woman who knows who she is, she can breathe, and has a personality to show for. And that was a treatment that was done in the correct order, because if we are putting the right treatment in the wrong order, we're struggling with the wrong treatment. Expansion without myofunctional therapy, I'm going to call that still a wrong treatment, even though we are providing what we know to be the best. Let me go back to the first line that catches everyone's attention. It's not that have your attention. Straight teeth, ladies and gentlemen, do not fit on cricket bodies. And here's the example. This is actually the intraoral pictures of Laura. The mandible has moved forward. The teeth have straightened themselves out without any braces or dental intervention because her body is a more habitable environment for her teeth. We did not need to touch the teeth. We did anti-dentistry. We let the body upright. When the mandible moves forward, I see the atlas to the occiput that had a better position. So we don't have to worry about any other treatments in our mouth. And let me leave you guys with this last slide. The book that changed my career for good, from James Nestor, who's going to be speaking to us tonight. No matter what you eat, how much you exercise, how skinny or young or wise you are, none of it matters if you're not breathing correctly. Thank you, James Nestor, for gifting us with this beautiful knowledge, bringing us all together, and thank you for your attention.